fighting COVID-19, and we have to go all the way to Migori, where Dr. Pamela Odhiambo, she's a woman representative Migori, is joining us live here. Thank you so much for making time for us, Daktari. What is the situation like right now in Migori when it comes to fighting COVID-19?
Good morning, Kenya. I'm happy to be here this morning. The situation of the COVID in Migori is a bit worrying because as at now, I think the recorded confirmed cases are about 10 or thereabout, and a number of people are in isolated situation, like a place at Mabera. I'm told we have about over 160 people in this isolation center, plus others that are spread over the county. And so, coupled with the trouble that we have of floods, I think all of us leaders, we are worried because these cases, if they are increasing, and majority of them, almost all of them actually are being associated with people who have either traveled from or to Tanzania and back. And that causes us concern over the movement across this border. Otherwise, there is no case that has been identified which has just originated from our side of the divide. And I think we are not doing very well because being a county where I know quite a number of the people are already living with immunocompromised conditions, and where our health facilities may not be in a position to accommodate large numbers in case of further increase in infections, then I'm a worried girl, I'm a worried mama, I'm a worried mother, and a worried leader.
Is there any coordination or intervention with the Tanzanian government? Because you're saying that it seems to be a cross-border infection. Is there any intervention measures that you've put in place?
Of course, as usual, we have our people at the border who are actually supposed to manage the people who are crossing and coming. But then our security apparatus is not very strong. We have few officers, we have few vehicles to manage that movement in terms of surveillance. And the border is rather very long and porous. Imagine all the way from Muguru Bay and Olasi in Nyatike sub-county to Kopanga, Masara, Kitabai in Sona West, Biriamidi, Mteburabu, Isebania, Masangora, Nyamitaro, and Center, Kegonga, Kugitimo, and all the way to Loliondo in Kilgoris. It's a very long and porous border. Apart from the main designated routes where people pass, there are quite a number of panya routes. For example, in Sona West, if you come from a point in Tanzania called Kogaja, somebody can likely branch somewhere and get in through Kitabai or Kopanga. And in the process, can evade even the checkup. So our greatest concern and worry is that there are quite a number of panya routes along this border, and it is that long. And therefore, we are thinking if nothing more is done in terms of increasing the resources in terms of vehicles to move our officers along the border, we are done. If we don't increase the personnel themselves to come and beef up what is already there, then it is very difficult to manage. And also given the rains, that whole connection I've just talked about has got a long road, sections of which are almost impassable as you move along that border. So to be honest, there is a little much more to be done in terms of resource beefing up in human resource and the vehicles.
Dr. Odhiambo, I'm thinking that from the border points that you've mentioned, it's quite a long one and they're very porous. I'm thinking even resource allocation will not be the only solution. Are you considering community border policing so that it's the community who informs you whether the people are passing there? Because even if you deploy the boots on the ground, that's an extremely long border point, which is very porous.
Of course, the community has to be uploaded. Even these cases that we are talking about, I think most of them were identified and noted courtesy of the community along the border, and including the chiefs and just the local people who, having been sensitized about the issue of COVID and having heard that in Tanzania there are cases, but their president is not willing to quarantine anyone, I think our community has been very alert. And this is how these people have been identified and have been known to have either traveled to Tanzania or come from Tanzania. And they have alerted the authorities, and these people have been traced and then tested, and some of them taken to this quarantine. So I think the community is very alert, except that, why we are still talking about the beefing up of the security. I may want to alert you, brother, that sometimes if you leave things to community, at some stage, when they get to feel like maybe the government is not doing much or they are on their own, you can imagine the chaos that some of them can actually cause. So we are appealing as leaders. We know they have done well and they are still continuing to do well, but we are appealing as leaders so that our security apparatus is proper, so that we don't end up with cases where maybe somebody is harassed because they came from Tanzania. We want it to be held done in a professional manner and with the security organs around to assist all the time. So we know there might be a serious strain, but you see, when the other side is not doing anything, it only calls for us. For example, if I have a neighbor, we have good relations, but then he does something to his children which is fatal, it's upon me to now take care of my children on my side, and that may call for double effort because the neighbor is become outrageous and maybe poisoning his own children. I will not allow them to also kill my children. I have to double the effort. That's why I was the other day, if you listen to me, I was even appealing that if possible, we could be beefed up using the GSU to help us man some of these places which the regular police and the border team may not be able to handle.
So what are you suggesting? Should there be a cessation of movement cross-border?
If possible, a temporal one could actually do, because we are hoping that this corona will be managed, and even as we embark on teaching people more ways of helping themselves and trying to cope with it, we can do this temporal stoppage of movement, especially of Kenyans going to Tanzania for whatever reason. For example, some of them along the border there, families have got their members on Kenyan side and on the Tanzanian side. So we can strictly curtail this movement. We saw nations close their borders, and even as we sit here today, we are not receiving international flights from anywhere because we have closed our border in a way. So I think even this one where people can walk on foot and cross over, somebody gives you reasons like they lost a loved one on the other side and they have to go for burial and things like that. We can temporarily stop this. I really think it will not really cause any harm because it is not something permanent. It is something that is just a measure to protect and cushion our vulnerable people from further infection and spread of the disease.
But what about the cross-border trade? Because there are those who say that's what they depend on. Have you mapped out the vulnerable people?
Of course, with that strictness, only those that are essential. For example, we have seen Uganda on the Busia and the side of Kenya. They are doing a serious scrutiny just to make sure that whoever is getting in with a lorry of goods or whatever it is. But you see, if we allow everybody else to come in the name of the trade, in fact, some of these people, I think the other day I heard that one of them was even traced all the way to Kisumu in the name of trade. So what would be of value? Do we kill our people and continue with trade, or we protect our people first and then continue with the trade later?
But have we mapped out the people?
Even these traders, we know there is that dependency. There are maize coming from Tanzania, fruits and things like that, and other things coming to Kenya, from Kenya to Tanzania. But if there is a need to check these people at all places, because major ones come from the known borders like Sirare or Isebania. But I've counted a number of panya routes that I want you to know, like this place I'm calling Kitabaye. It's a one-stop border. Kopanga is a one-stop border, and even Nyamitiro is a one spot, but it's like not, it's loosely guarded. It is loosely guarded, and it